Welcome to the Astrid Mueller Show. My name is Astrid Mueller. I got well from breast cancer stage 4, and I wrote the book Permission to Sparkle. I'm on a mission to inspire people around the world
to what's possible.
Today, I'm here with a special Integrative Wellness Leader Talk series where I interview leaders in wellness, and we get to discover ideas to support ourselves: body, mind, emotion, spirit, soul. Get ready for an inspiring interview and to discover what's possible. Hello, everyone. Welcome to my Astrid Mueller Show. I am here with a next episode of my Integrative Wellness Leader Talk series. You are in the right place if you'd like to get inspired for your life and your wellness on all areas of your being: body, mind, emotion, spirit, soul, because there's so much we can discover and boost and really come to thriving and flourishing. And this episode will have a lot of juicy inspiration for you for that. So I'm going to reveal who I will be talking with. So we have a cardiologist with us, a lifestyle medicine physician, behavioral medicine pioneer, and he was one of the early researchers who helped demonstrate that psychological stress directly affects the heart. Over more than 4 decades, he has authored over 300 scientific publications and held leadership roles in cardiology, education, and research. What I'm really fascinated about, though, is how his work has evolved and his perspective and what he's up to today, because he's asking much bigger questions, like what truly creates health and vitality? How is our heart connected with wellness? And how can we improve overall health all the way to flourishing and not just, being okay? So he also has a really cool thing where he developed 6 domains of health and vitality as a framework to inspire people and to actively optimize your well-being and health. Welcome, Dr. Alan Rozanski. I'm so happy to have you.
Thank you, Astrid. It's a real pleasure to be here. I appreciate it.
Appreciate you. So tell us a bit more. Anything that I forgot about your bio description? Where did you come from the beginning and your education? Anything I missed up to way to today?
I think you hit the headlines there. It's been a journey, as we say. I started off in doing conventional cardiology and then got involved in cardiac imaging. And that allowed me to image the heart. And eventually, it was a long story, but based on certain research, we created some work to look at the heart, not just under exercise, but under mental stress. Mm-hmm. And imaging these patients who had pretty advanced heart disease, I would mention, we noticed that just when people were speaking about the stress in their lives, they were developing abnormalities in heart function. The heart wall motion, actually, if they had a significant blockage, was slowing down. This was work all the way back in the 1980s. And at the time, it was stunning. It was revolutionary. For me, it was my aha moment. And it led to a sabbatical fellowship to study this in more depth. And then I've been at it for 40 years. And there's been a lot of growth and transition. And as you say, perspectives that have changed over time as I've been involved with this.
Wow. So that sounds amazing. So let's backtrack a little bit so people can really capture that gem. You had an epiphany moment, and I heard you say that you discovered that people were speaking about stress and then it changed their health. Is that what you were saying?
Yeah. Let me put 2 qualifiers in that. This was back in the 1980s when heart disease was significantly more severe than it is today. Mm-hmm. So in those days, it was very common to see people developing what we call myocardial ischemia, which means lack of blood supply while they would exercise. Today, we still see it, but it tends to be milder in extent. We've transformed this disease because we've brought down cholesterol levels and people don't smoke like they used to and so forth. So the disease is actually milder. It's still the leading cause of death in the country. But in those days, we would see a lot of ischemia in people who had advanced heart disease. But we were just putting them on an exercise bike or we put them on a treadmill to induce that ischemia, lack of blood supply. Well, data came out in the 1980s using another technique called ambulatory electrocardiography, which allowed us to look at people's electrocardiogram while they were engaged in their daily activities. And we were noticing, to our surprise, that again, among patients with heart disease, not normal people without heart disease, some people were developing these abnormalities while they were driving their car, doing housework, or activities which certainly didn't look very stressful. And we didn't know what was precipitating all of this. So that led to my idea to, hey, wait a second, we can study, at least model some of this in the laboratory. So we did exactly that. And we had patients, when they were coming in for exercise stress testing before they went on a bike, we had them do a series of mental tasks. Some of these were just cognitive, like subtract serial sevens from a 4-digit number. But one of the tasks was just to ask people speak about the stress that they were experiencing in their lives.
Okay.
And the early patients were talking about losing their job or, difficulties they'd had with their children or things like that. And as they're talking about these emotionally stressful aspects, lo and behold, as we're looking at the wall motion of the heart, we would start to see some of this decrease in wall motion in areas of blocked coronary arteries that we were seeing with exercise. So in other words, what we were trying to precipitate during maximal effort on a bicycle was occurring simply by people talking about the stress that they were experiencing. So this was my aha moment. That was like stunning at the time. And then one thing then led to the next.
So, awesome. So just to translate that I fully got this right. So people were speaking about the stress and that increased the problems with the heart. Is that correct?
It didn't increase the problems of the heart. It just showed that there was a propensity or risk that these people had, which is what the goal of stress testing is. We take people who come in with chest pain, for example, and we don't know if that's due to heart disease or not. And if we will put them on a treadmill or bike and measure either the blood flow or wall motion, if we see abnormality, if it's mild, we might treat it with medication. If it's severe, we might consider an angioplasty or bypass surgery. This is something we've done since the 1970s.
Okay. So I'm just still understanding, was it good for them to speak about their stress or not good for their health? What happened? I'm trying to check.
No, it's a great question. It's a great question. So there's a couple aspects to that. In a diagnostic sense, what this did is it, just showed that, it increased the understanding of what was causing ischemia in patients. So it increased our understanding of why people, let's say, doing daily life activities with significant heart disease, more significant than we see today, were developing these abnormalities in heart function, because we weren't understanding it. And now we had a better understanding based on this study. And then for a few years, I spent a lot of time looking at the effects of acute stress on heart disease. And the real importance was that I graduated from that to begin looking at the effects of chronic factors and how they affect heart disease. So we began, and I want to say, I say collectively, people in this new area in the 1980s of behavioral medicine, which was a nascent field at that time, a field which until that time had not had epidemiological tools and the physiological tools, which were just coming online in the 1980s. And so this was an exciting new field. And what this field was indicating, people who have depression, people who are with social isolation, people with a lot of chronic stress were actually at higher risk for developing heart attacks, even sudden death, and other chronic illnesses. And so this was what I began to get involved with as a transition from this initial work I did.
Okay, cool. I think now I got it. Thank you for reiterating. I wanted to make sure we totally got it. So what I heard you say is that that was the beginning of the era of mind-body medicine, right? To become aware that stress has an impact, direct impact on the heart. And so your studies were comparing people who had stressors, like stressed out about their life, and you noticed that it really directly impacted their heart. That's what you were saying.
That's correct. And that became the entree to other work.
Yeah.
Yes.
Yes. Awesome. Yeah. I was curious because there are different ways we could have gone. There are also studies that I'm aware of, or my own experience even, of like using words and how they can affect our own stress, and speaking negative words, and they the power of words. So I wasn't sure if you were going with testing those.
Well, but that is true what you say. I mean, that's what we say to ourselves is one of the things we use in stress management and in terms of developing a more, let's say, flourishing mindset. Absolutely.
Mm-hmm. Yes. Awesome. So that was your beginning, and you became curious and you studied more about this correlation, and you were a pioneer in the field. So take us a bit closer to the present. So what were some key highlights that you got really excited about in your studies for the bigger scope of wellness?
Sure. Well, the whole field, I feel so blessed because it's been 40 years of an exciting journey. And in that era of the 1980s, let's say till about 2000, I, along with most doctors, were focused on what are risk factors for heart disease. Mm-hmm. And in the psychological domain, I began to realize we don't have to have any debate. The body testifies as to what's healthy and what's unhealthy. Those things which promote longevity, protect you from disease, which protect your physiology, those are healthy. Those things which do the opposite, shorten your lifespan, which cause chronic disease and disturb your physiology, such as smoking, for example, are unhealthy. So I began to realize we could look at all of this very objectively. And that's actually what led to my understanding of these 6 domains of health. I was just looking objectively at what are all the different factors that cause heart disease.
Cool. Since you already mentioned those 6 domains that you discovered, can you walk us through them a little bit so people can become curious of what would promote their longevity, and how do you see those factors?
Sure. Well, what's most known to people, obviously, is the physical domain. That's highly emphasized. And we know clearly, and no one disputes it, the value of exercise and movement in terms of promoting health. It augments the physiological function of the body. People who exercise regularly do live longer, and they have a less risk of heart disease, even many cancers, diabetes, hypertension, and so forth. Maybe more unrecognized, but increasingly recognized, is the importance of muscle care and resistance training. Clearly, the role of our diet, it plays a huge role in health, and then sleep, having, good sleep quality and adequate sleep. So those are what I would say would be the 4 physical pillars in terms of optimal health. But that's one domain, physical health. But then you go through these other domains. So there's the area of our mindsets. So it turns out that people, for example, who are optimistic, live longer, they have a shortened risk of heart disease, and pessimists are the opposite. In a meta-analysis that we published about 7-8 years ago, we showed that people, based on a series of 10 to 12 studies, that people who were optimistic actually had a 35% reduction in cardiovascular disease risk. So that's very substantial. Gratitude also has been shown to be associated with greater longevity as well. So you have your mindset area, and there's other aspects of what I would call mental vitality, which produce, better physical health and better well-being and so forth. But that's your second domain. The third domain is the quality of your emotional life. So in the 80s, it was quite established that people who were depressed were at increased risk for heart disease and other illnesses. What we began to realize was how profound that is. Literally, if people living with depression not successfully treated, the body's physiology in practically all the systems go awry. People develop insulin resistance, visceral fat. They develop abnormalities in the endothelial lining of the arteries. The amygdala, or the fear center of the brain, gets enlarged. The prefrontal cortex diminishes, and longevity is impaired substantially. Fortunately, we have very good treatments for depression. But what we began to look at was the opposite. The people who actually live with, in a sense of positivity, with happiness and other emotions, actually had better health and better physiology. So that's your third domain. Your fourth domain is the quality of your social life. So people who feel lonely actually have increased risk for heart disease and other ailments as well. And having a strong sense of social connections with people is health protective. The data is very substantial in that area, both in terms of physiological data and in terms of epidemiological study. The area that's probably the most Johnny-come-lately has been our sense of life purpose. First studies about this began to appear about 15 years ago, but there's enough data that we were able actually to write a meta-analysis on this as well, which again showed that people who have a strong sense of life purpose live longer, have less heart disease, and people who have a sense of boredom and don't have a sense of life purpose don't do as well.
Yeah.
That leaves one other domain, which is how you handle stress. And this is probably the most misunderstood domain. There is clear data that what we might call toxic stress, which is stress which you don't feel you can manage, which has a lot of emotional negativity, which seems senseless and meaningless, like being subjected to severe trauma, is actually very health damaging. But on the other hand, the overall relationship between stress and health outcomes is U-shaped. And people do best in the sweet spot of having maybe even a moderate amount of stress. And that's because we are built as people to pursue a sense of meaning and growth. And we thrive best when we do that. And that comes with accepting challenges. And when you do, and when you thrive in handling your stress, it builds optimism, self-confidence, growth, well-being. So, there's the two sides of stress. And that's very important to emphasize, because so much of the newspapers and so forth want to emphasize, hey, this new study came out and stress does this, stress does that. And sometimes I wince because, if people are telling themselves stress is bad, that is actually something that's affecting how they can handle stress. So it's important to emphasize the
irony. Yeah, because it can affect their mindset, and then they're scared, and then they down spiral, and it's like stressful in itself, right? Yeah, exactly. I hear you. And I also hear the piece of discernment and everything, right? So when you say like that stress is U-shaped, the way you describe it, it can be like toxic stress, but there's also good kind of level of stress. So that brings me to any area in life. It's like always like finding the healthy balance with everything, right? It's like, does it feel health producing and life affirming or not, right? And
it is extremely life affirming. It's important to, there's a book actually published way back called The Road Less Traveled by M. Scott Peck. He was a psychiatrist. Okay. When he first published his book, it was not a bestseller. And then it became a bestseller and was on the New York Times bestseller list for over 5 years. And he starts his book by saying that life is difficult. And he says, but once you acknowledge this, your life becomes less difficult.
Yeah.
So life is full of challenges, and if you want to grow, you can't be comfortable. And if you're committed to being comfortable, you'll inhibit your growth. So you always have to balance that. And life is full of different stresses, different priorities. And we're always managing those different priorities. So every human being, without exception, feels a pull in terms of their priorities.
This is beautiful. So, okay. So now that you have your 6 domains of health, the way you look at things and consult people, because you're still an active physician, right? You still work with people. So how do you recommend people, what should people do with that? Like, how do they navigate and optimize their health?
Right. So there's one other missing piece to this puzzle that I began to realize probably 20 years ago. And this was the key part here, which was that all of these domains, are separate, but they're all interrelated. And the way they're interrelated is that each of them has a common characteristic that when you thrive in each of these domains, they produce a sense of vitality. And by vitality, I said, gee, if I'm going to be scientific about this, all my terms have to be defined. But I didn't make up the definition. I actually found it in some medical papers in the early 1980s where they defined that vitality as that inner pleasurable sense of feeling energetic and alive. And I think this is an excellent definition of what I would call positive health. So when we feel a sense of vitality, feeling energetic, that's a vital sign. When you feel that sense, you're probably doing well in each of these 6 domains of health. And when you don't, you can look at this as a vital sign. If I'm not feeling energetic and I don't feel alive, why? Is it because I'm sluggish and I'm not getting enough sleep, or I've been, neglecting my physical health? Is it because I feel lonely? Is it because I'm not managing the stress in my lives? Is it because my job doesn't pull for me and I feel like I'm spinning my wheels? Or maybe I'm ruminating too much and I'm just stuck in a negative mindset loop. Nice. So you can look at your life and you can use this as a vital sign. Now, why this is key is that people don't have that definition of health. When you ask people, and I've done this for years, I've gone around asking doctors, colleagues, and people in general, I said, how do you define health? I get a smile like you're being cute, or I get like a thoughtful answer like health is, both physical and mental and social well-being, some combination, but it's clear that people are using that in a euphemistic way. They're not really using it as a guide to life. Now, the problem with that is that, you go to your doctor and let's say you're feeling sluggish or fatigued, or you're even having some sort of chest pain or arm pain. And the doctor will go through tests and they will measure your cholesterol and an electrocardiogram. They might end up doing a stress test, for example, and you might get a quote unquote clean bill of health. Well, that is assertion that you don't have, a physical health problem at the moment. Yeah. But it doesn't necessarily mean that you're feeling healthy the way I define it. I define health as that sense of feeling energetic and alive. So what happens is that because you don't have that operative definition, you won't be thinking about, gee, what are things that are impairing me that I am feeling sluggish and I'm not at my best, because you were looking at health in a more limited way. So this is a very much broader way of looking at health. And it also gives you all these entree points to pursuing it, because once you use this as a kind of a vital sign, my sense of vitality is down, then you can use these 6 domains of health as a map. You can say, what are these domains am I not thriving in that I can do better in?
Yes. I am so excited that you're speaking to all of this. And we'll go into your view on the medical field in just a second. But I want to recap for everybody listening or seeing this, that here's a really powerful tool that we just got from Dr. Rozanski is that, first of all, I love your definition of do we have a sense of feeling energetic and alive as a definition of health? And because that we feel that personally, right? Like we can sense like, oh no, I'm not really, well, whatever. And we might not know why or what, but we can tell how we're feeling, right? So that's our personal important information we need to check in with. And just going to a doctor does not give us that answer because they don't see how we feel and our senses, right? So I love that you're saying that. That's also what we're all like about in the Integrative Wellness Network, to really come back to your own navigator and like listen within, right? Like, what is your insight telling you how you feel, or even your intuition? So with that being said, you come back to And that's also how I see it. Like we come back to feeling in power, right? We don't just give our power away to somebody to tell us, are we healthy or not, getting the clean bill of health, which can be beautiful confirmation and helpful. But we're taking the power back for our own health and actually asking ourselves. So that's also a mindset thing, right? Because then you feel empowered and not like a victim. And that's from my experience, right? So when we have that, then I want everybody to know Dr. Rozanski has a really beautiful website where you actually talk about your 6 domains of health. So we can then, if we feel sluggish or, like you said, just somehow don't feel fully alive, we can go to the website, for example, and look a little bit, just ask ourselves, physical, does that feel good? Mental, and we will know where it resonates, right? Of like, oh, there's something there. Oh, that's right. I just had a fight with my relative. I'm like, of course, whatever it is, right?
Yeah,
so
right.
I just wanted to bring that back to a really practical piece.
Yes.
Bring back,
Yes, I think that's true. And then the question is how to thrive in each of those domains. And there's many tools, and we're always growing in terms of how we can live with more purpose, for example.
Absolutely. And I love what you just said. Like the question then is, how do we thrive in the domains, right? And so tell us a bit more. I know there's also a story for you in your evolution as a medical professional, where you were in the medical system and at some point you realized there was something missing. Can you tell us a bit more of what was your experience and what's you now?
Yeah, well, I wouldn't. It's not like, look, our medical system is awesome. Mm-hmm. What we have done is incredible. For example, in my work as a cardiologist, I've seen it all. Compared to the peak of we had a 20th century epidemic of heart disease, which led to this war against heart disease, which began with the famous Framingham study in the late 1940s, where they established, let's study this Framingham community. And by the early 1960s, they had identified these major risk factors for heart disease: smoking, high blood pressure, high cholesterol, diabetes, and so forth. And that initiated the war against heart disease. But since 1970, when heart disease was just essentially at its peak, and 3 times as many people were dying from heart disease compared to cancer, we have brought that down by 70%. So right now, heart disease and cancer are almost neck and neck. We're still the number one cause of mortality, but much closer to the rate with cancer. So this has been a tremendous success. Cool. And what medicine is doing is terrific. And we've led to people living longer, right? I mean, now we're seeing this evolution where we're seeing many people who are thriving in their 80s and 90s and so forth. But we're seeing many people who are not thriving at older ages because they maybe not have done as much as they could have done at earlier points in life to put themselves in place to thrive as they're older. Now, the thing about the health system is you don't want to wait till you need to see a doctor, right? Because you might be developing, for example, let's take resistance training, for example. It is so vital to health, we've now learned, okay? But if you go through these decades in midlife and you're not paying attention to your muscles as you reach older age, what's happening is from age 30 on, you are losing about 3 to 8% of your muscle mass per decade. And after age 60, it's accelerating.
Oh, wow.
And if you do nothing, you are going to, and that's so thrive when you're in your 80s. You're going to be weaker. It's going to be harder to play with your kids. It's going to be harder to lift luggages and so forth. Well, guess what? If you are actually intentional about that when you're younger, then you will not lose muscle mass as quickly. You'll have more strength and you will enjoy life more as you get older. However, part of the catch is, what's the human condition? We have many things on our plate at any one time. So if I would talk to people about their health, and I'm just talking about, gee, if you exercise now, or if you do resistance training now, you will feel better when you're 80. Mm-hmm. People will understand that, okay, and they will then say, yeah, and tomorrow I'll start doing that.
Yes.
Today I got a lot on my plate. So therefore, it gets put off by days, months, years, and decades. That's what happens. But if you say, wait a second, this is something that increases my sense of energy and vitality, and therefore handling things better in my life, and I'm, feeling more confident in my work, and actually, improving my sense of creativity, which is part of what exercise does too. That's a whole different approach, and so you're selling the present benefits of doing the health things as opposed to manana syndrome. That's the whole point.
Yeah. Oh, you went in a really interesting direction with this.
Your question was so interesting, but it really wasn't one thing. It was something that evolved in my understanding over many years.
Yes. Okay. So let me take a few pieces that I heard, and I know there's so much inspiration in there. So first of all, I have experienced this mindset that comes up for me when I hear like, oh, do this and that's good for your health. And then I don't feel it's a new thing to do. Right. And if you like, new things are always like they take an effort to try a new thing or an additional thing. Oh, depending on how busy somebody is. For me, it is when I feel like, oh, that doesn't sound like fun. I don't want to do it. It sounds like work. I have to. That's not fun. So anyway, there's a lot of reasons to kind of defer the thing and to not do it, especially when it's when it comes to me as like oh, you should be doing this, right? It's not really an incentive. So I love that you compared the two. Like we can look at it like we should be doing this and it will be helping us down the road, whatever, but bringing it back to the present and to possibility, which is also part of your view of possibility thinking, optimism, right? And like that kind of framework of thinking. You hinted at, we can look at it differently then and saying like, oh, did you know, become curious, did you know by doing just a little bit every day, you can increase your creativity, your energy, you feel more alive and so forth, and your life becomes totally better. That I love that reframe, right? Do you want to speak to that? And then I have an example for that.
Sure. Well, as I listen to what you're just saying, it's this common thing we all go through. We dabble in this, we dabble in that, right? Mm-hmm. And life gets busy, and then we forget about this and forget about that.
Yeah.
Well, if you take these 6 domains seriously, and you understand that each one there's a pathway, and to some degree a necessity to feel vital as you go along. Mm-hmm. Then the key thing is to say, I'm not going to necessarily thrive in all of these domains, but I have to have minimal standards in each one of them. Mm-hmm. So, for example, you can take that sense for feeling socially connected and you can totally sublimate it. Even though we thrive in terms of our life, in terms of having social connections, we can go through a period in our life where, hey, I have work colleagues and I really should pay more attention to the friends that I grew up with and so forth, but I'm just so busy. Mm-hmm. And the enthrallment with your work can give you a sense of vitality in that way, and it's very easy to ignore your social life.
Yeah.
For a long period of time. And sometimes over the course of a career. And then, voila, we have an epidemic among older people in terms of loneliness. Because what happens is eventually you will retire or your job won't have the same significance. But if you let those social relationships that you had over the years wither, well, you lost those special relationships. Mm-hmm. But if you're intentional about it and say, I'll have some minimum standards so that, maybe once a month even, I will touch bases with, some dear friends, then that won't happen. But you got to think about it. You have to have the minimal standards there. You have to have the minimal standards in terms of what I'm doing in terms of my physical health and in terms of, as we just talked about, muscle care in all these areas. So that is a bit of work in life. But the people who are high performers in life, understand and put these different parts together. I mean, let's say CEOs running, a large corporation with many components. They will know what's the key part in each one of them. Well, we're the CEOs of our own life. So we need to know that these are the main domains, and we need to know principles on how to succeed in each one of them.
I love it. And I love that you have your own unique perspective, and also how you're choosing your words, and how your operating system has to do with structure and with standards. And that works for many people. So thank you for sharing that. And I love that you brought also high performer viewpoint, that they're aware of such things, and that they would look at the 6 domains of health, and that they that's important to them to actually tweak them and optimize them as they go along, without having to be perfect, right? But being aware and balancing. And so from my perspective, I'm bringing that, I have a different operating system and that's okay. We all have languages. So for me, I get motivated, and everybody can ask themselves, what do you get motivated by, right? Like, what's your lingo? What helps you do healthy things for yourself? So for me, it is, like I mentioned, it is when something brings me joy. And sometimes it's also playful nudges, and it's community also helps me. So I have a practical example. So I actually, I'm currently doing a 5-minute a day movement challenge for myself, 14 days. And and I decided, okay, if I'm going to do this, I need some accountability. So I put it in the Integrative Wellness Network, in our wellness community. And I said, this is what I'm doing. If anybody wants to join me, right? 5 minutes a day. And I'm like, okay, I can do 5 minutes a day. And then I thought, okay, so what will bring me joy? Like, in what ways do I love to move? And for me, it's not going to the gym. That feels like a dungeon and terrible. For me, it again has to be playful. So I have a exercise ball, and I have a ball that I can use for a weight. I like music and things like that. And so I took the challenge for myself, and I started, and the community helped me in the sense of every day I said I'm going to do this, so I'm going to do this. But what happened was, it was so funny. It's just 5 minutes, right? And everybody can say, we have 5 minutes. Sometimes they feel so long, but I'm going through it. And I want to celebrate that even just 3 days or 2 days, I feel invigorated. I feel like I have a better posture. I feel more energized. I feel more bubbly. Like when I was speaking with my mom, she's like, wow, you have such good vibes, good energy. All these, I feel stronger. There was one exercise that I wasn't able to do. It's like a yoga thing where you do a bridge and you hold your hands back, and and I still fully can't do it, but I was zero able to do it. Right. And after 4 days or something, suddenly I can lift my body, and I'm like, oh my God. And it was just 5 minutes a day. So we have a lot of misconceptions in our head of what we have time for, of how much it takes to change things. It's insane, right? And then also, what I also found, and I'm sure there are exercise gurus, they know all this. It's when we start something with a micro action, which I'll just take the 5 minutes a day as a micro action. A lot of times you end up liking it so much that you do more. And a lot of times I did 8 minutes. Suddenly I was dancing and having this cool move going on, and being in the sun, doing yoga, whatever. So it's getting started, right? You want to speak to
I tell you, I really want to, what you just said was priceless. And if I could just feed back in terms of what I heard, because it is priceless. What I heard is that, first of all, you're clearly proactive in terms of your health. And,
well, right.
And it's easy to put that off because we get so busy in one area or another. And then you're expressing such a key concept of, it's 5 minutes here, it's 5 minutes there. The power of what I call the first step, the power of what can be accomplished with 5 minutes is enormous. And it's a very powerful message. And what it does is it takes time out of the equation, because I've had many patients. I mean, one of the first places I'll start, and I'm going to come back and address this in a moment more, is getting people to move. And so I deal as a cardiologist with a lot of sedentary people. And I know what the guidelines are in terms of we want to get people to 30 minutes, 5 times a week, 150 minutes of exercise. But that's aerobic success. I want psychological success. So I want people first to get on the playing field. And so what I try to do is get sedentary people to commit to 5 minutes a day, just as you're talking.
That's great. Okay.
And the reaction I often get, doc, that's all. But a lot of patients don't get there right away. It turns out going from nothing to something can be often much more difficult than we think.
I know.
We all know that. And we have to, once we understand and acknowledge our humanity about that and the humility we have to have about it, because we're all in that soup, there's something in our lives that we're all finding it's hard to do those 5 minutes. Okay. So you're expressing that in what you said. And then it's so interesting that you came up with talking about exercise, because a common thing is, I got these 6 domains. Where do I start? And the answer is, as you talked about, you have a different operating system. And really, that is part of the creativity of it. You can take the principles that we're talking about, and the 6 domains of health are just 6 principles. But then you have to develop your own operating system that's unique to you and how you do it. So, for example, if let's say you said, I'm suffering from poor time management. Let me pick up a time management book. And there's some great ones. Well, the thing about that is what you're reading is what worked for somebody else.
Yes.
Really, we have to develop our own time management book, our own stress management book, our own life management book. But we develop the principles, and then we progress and we see what works for us. Now, having said that, one thing also that I would say, and it was representing what you said, is everyone who's health-oriented and succeeding, somehow it seems like they're exercising. It is like the master single place to start. When you move more, it's not just physical, it's spiritual. It's affecting your mindset. In fact, we have classic data. It was actually done with one of my dear colleagues, Jim Blumenthal, down at Duke, and he was the director of the cardiac rehab program there for many years. And he did classic work where they randomized people with depression to an antidepressant with an SSRI or to an exercise training program.
What's SSRI?
An antidepressant medication.
Okay.
Medications used to treat depression. Patients were randomized to either that on a random basis or to an exercise training program. And they found the same reduction in depression in both arms of the study.
Wow.
So, and that's to the point today it is recognized by the American Psychiatric Association that exercise is a very useful adjunct to the treatment of depression. Sometimes you definitely need to use medications, no question. I'm not saying that you don't have to use them and you can just exercise. But there's so much data now in terms of exercise being a mood booster and a preventative in terms of depression. So it's not just the physical, it provides you with that sense of vitality and energy and movement. And one thing, again, leads to the next.
Thank you for sharing that. That's a really cool study that you mentioned and I'm going to reiterate what I heard, that they tested antidepressant and bringing in the sense of movement or actual movement into the study, and that you found that movement has about the same level of impact to help with depression that medication also does, without saying it's not never helpful, but it's as powerful and absolutely helpful. Yeah.
It was, of course, randomized control studies, so you wouldn't extrapolate from them in terms of how a psychiatrist would treat depression, except to really understand the importance of exercise as an adjunct I would say, to treating depression.
Yes, yes. And I love, all this conversation also really comes back to something that we talk about a lot in the Integrative Wellness Network is how everything is interconnected. And I felt this in my own experience now with this 5 minutes a day play happiness movement challenge that I did or am still doing is that it brings me more joy. And also when I have when I suddenly I feel better in my body. So I'm like, whoa, I'm feeling more vibrant. That lifts my happiness. And it also affects my mindset. I'm like, oh, I thought I'm getting older. Like, oh, there's something wrong. I don't have as much energy. No, suddenly I have more energy and I bust that mindset, right? And then I feel better about myself because I can use muscles that I didn't really use before as much. And I feel I look better. Everything else is like, it's so interconnected. And it's interesting that you also mentioned the spiritual aspect. Can you say, what did you mean by that? Can you give an example when you exercise? It's not just for the body, but also spiritual benefits. Like, how do you view that? I'm curious.
Well, I use the word spiritual in a very broad sense, that sense of feeling energetic and alive and feeling, empowered. That's how I would use it. Yes.
Yes. Nice. You know what's so interesting? Like, and this is coming from my journey, overcoming cancer, where I made joy my focus, and when I did that, that's based on my unique experience, where I literally got an intuition when I was totally overwhelmed, depressed, feeling really heavy emotions, and super stressed out. I got the intuition that, Astrid, if you create wellness feelings, if you want to get well, you have to create wellness feelings. That was the intuition that I got, and so that was my big beacon to always create wellness feelings. And then I always ask myself, well, what will help me create more wellness feelings? Like, which wellness feelings are like joy for me, right? Like, so joy was my focus. And so I can go so many ways now. I kind of lost my original thought. But I used movement also as one of the pieces that came in that whole journey of, I know where I was going to go with this. It was the vitality piece, because on my journey, because I played with joy as my focus with everything, that was kind of my inner compass for everything. Always asking myself, what will lead me to more joy? Sometimes it was movement. Sometimes it was nurture my body with food. I needed soul food. Sometimes it was focusing on my dreams and what I want to do in life purpose. Sometimes it was advocating for myself and literally, standing up for myself and saying what feels right for me, all these things. But practicing joy, focus, and walking in that path, I really got a sense of my inner vitality, because that is also really like my personal measure of how healthy I feel, and feeling this bubbling energy that I believe we all have inside when we nurture it, right? Like, it's almost like, I call it the sparkle scale. Like, we can say, like, how sparkly do I feel today? On a scale of 1 to 10. That's like my measure. And then when I raise that, I can raise that with many ways, like with your 6 domains of health. It can be something else, but like, it's always about how can I increase that? And then when I do that, I feel it feeds the well-being of everything, right? Because when I feel vibrant and alive, I literally feel that in my body. It's like bubbling, sparkling, and I feel my cells feel it, and joy vibrates through me. I feel how healthy that feels. Do you want to speak to that as a medical professional?
Yes, I do. And I'm really in awe of what you just shared. First of all, to have gone through cancer and survive and figured this out, that's incredible. That is great. And I think that what you're saying is, I think we're just totally aligned, because you're just using the same concept. I think you're using the word joy in a broader sense.
Yes.
And it really aligns with what I'm saying in terms of the word vitality. That sense of feeling energetic and alive, you're using the word joy. But what you were saying here is that you look for what are those things that produce that for you. And then what you're sharing is that, well, you had a repertoire. It just wasn't one thing. So if it wasn't one thing, you could look at something else that would bring that sense of joy out for you, or I would say sense of vitality out for you. So it's you're the expert because you've done it.
Well, we're both, and we're all our own experts for ourselves, right? Because we have some principles. So thank you, and back to you also. I love that you're seeing this also as a medical professional, and that you're correlating that sense of vitality to. There was one thing that I did want to bring up as a curiosity for people, and this is also sparked from your story of what I saw, relating to how the medical system is often viewed by society. To go and fix yourself, and like the perspective of the medical field a lot of times of how something is wrong. What is wrong? Let's fix what is wrong instead of you focus on what's possible, right? Can you speak to that and what is different with that?
So, yes, absolutely. So the medical field, as I've said before, to reiterate, is incredible. I stand in awe of all that it's accomplished. That said, doctors are trained to, first and foremost, be healers, cure disease. And we're like in an emergency situation. There's so many people who have significant health problems. And today we have a shortage. We need more health practitioners. There's waits for, appointment and things like that. And so the first job of a doctor, is to heal. But there is this broader sense that we're talking about, that if you're not understanding the other side of flourishing, then people will miss out on opportunities to flourish that could be suggested to them and weren't, because, again, just using that analogy of a person coming with fatigue, and if you just test them for, what's ill is and having excluded that, if you're just giving them, okay, well, there's nothing really wrong, you really haven't addressed maybe why they're feeling fatigued. And so that to me is a limitation, that I do think that there is an increasing cognizance in the medical world to that particular point. In fact, there's this new organization, it's been around 20 years, called the American College of Lifestyle Medicine. And it started with a few thousand people. It's now grown to, I think, a community of 25,000 people. I'm a member of that community. I'm actually a lifestyle medicine physician as well as a cardiologist. And I am awed by the dynamism of that organization. And it's growing, and they're training more people. And so there is this movement that's out there. And then the blessings of all of, let's include, the nutritionists, the exercise physiologists, the integrated people, the people in functional medicine. There's a wealth of groundswell, and people are looking for opportunities to improve their sense of well-being. I think that the increasing longevity of people and awareness of people here, hey, this person's thriving in their 90s. I want that for myself, and I think that this is pulling people to have much more curiosity about what can I do to take personal responsibility to flourish more in my own life.
I love this so much. I'm so happy to hear all these developments and seeing them come about. And I was so happy to find you as part of all of this, to be a big advocate for what's possible and what we can do. And it's so empowering. So thank you so much. So
my pleasure.
Is there one last question you think I have not asked that you would really speak to?
That's a great question. I would emphasize that power of the first step. Whenever you have a podcast like this, and people might hear a lot of things, anytime you hear words that might be inspiring to you, if you don't link it to action, it'll be just a thought. The way to anchor and grow from any podcast you might have heard is say, is there one thing that I can do to translate into my life? Just one little thing. So if you hear something from this in those 6 domains, you can say, is there one thing I can do once a day? 1 minute of breathing exercise, 1 minute of, maybe I'll just stand on one leg when I brush my teeth. Maybe maybe 1 minute of writing, I'll put a book on my desk I've been wanting to read, or making, 1 call per day, take one thing and make that your anchor. And if you do that consistently, consistency is the secret sauce of success. So it can be one thing, but if you do it consistently, you will grow and you will be different a year from now.
Yes, totally. Thank you for bringing it back to that first step. And I love that you brought the toothbrushing thing, because I think that's actually brilliant, because it's something, it links our brain to something we're already doing. So you can tell yourself, oh, there's another thing for me to add during the day. Right? You're already doing that. So what can you do while you're brushing your teeth? I've actually used that. That's why I was laughing. A lot of times I do that too. It's like when I feel like, I want to strengthen my abdominal muscles, for example, I'm doing like the matrix move when I brush my teeth and go like this. And then I can tell myself, and I know I'm actually using the muscles, and I'm telling myself, I'm also doing exercise that way. And sometimes I move while I brush my teeth and it feels good. And then sometimes I want to move more. So that can be a first step for everybody, right? Like when we do something that we're already doing. So given the curiosity to all of our listeners and viewers, do something now, like take 1 minute or 5 minutes, and then ask yourself, like, in what way would that feel good to do it again tomorrow? Like, when would you do it? And do you want accountability? Like, our wellness community can be such an accountability place. It's a free community. We literally have a category celebration. So you can come in whenever you did something, celebrating. And this is not about, I don't want to claim the spotlight. This is not about me. That's what the community is for, that we can all share our actions for longevity and happy life and thriving, right? Like when you do good stuff for yourself. So people can do that also. So yay, I'm excited to see people celebrate actions more, and would love to hear what came up from you, listeners and viewers. So thank you again so much, Dr. Rozanski. I'm going to put your website in the show notes. The domains, 6 domains of health are there. There are more resources. You can go deeper, everyone, and find links to more inspiring pathways you can go down to, all empowering for wellness and health.
Right.
Thank you, Dr. Rozanski. It was so amazing to have you. Really appreciate you.
Thank you. Thank you for having me. It's been a real pleasure.
Thank you so much for watching or listening. Question: what did this spark in you today? Take one baby step and act on it. One small step can change your world and will ripple to others. The world really needs more sparkle. If you like more inspiration like this, come join us in our free Integrative Wellness Oasis on School. We are an amazing community of wellness lovers and professionals where you get to discover new ideas, resources, and also really cool virtual retreats. We love going on virtual cruises too. If you loved this episode, please share it with someone who might love this inspiration as well. Until next time, keep exploring and follow the sparkle.